Interviewing Kate, and she's going to be talking about insurance. And take it away.
You had asked about insurance and of
like health insurance.
Yeah, I'm definitely insured. We have really great insurance. We don't have to worry about pre-existing conditions because we have my husband's an employee of OSU, and they have really great insurance. And so, the bigger the institution, the better the health insurance. And they don't ask about pre-existing conditions. Our rates raise annually, but they're pretty expensive. But we get a lot for what we pay for in this country. It's fair because we do get a lot for that money. I'm glad we have access to that. The most interesting thing about insurance is our experience in New Zealand. They have health insurance, which is really a national policy. They see that health care is just a human right, and so through taxes they fund their health system. We lived over there for a year, and as residents we had total access to everything, never charge you for anything, unless it's way above and beyond, and then it'll be a very nominal fee to an American. I broke my arm, and I had a choice of going to the emergency room, and that would have been completely free. Surgery, cast, physical therapy, $0. Instead, I wanted to have it go faster, and so I went to the fracture clinic, and people warned me it would be very, very expensive. It turned out it was $45, one-time charge. That covered and would cover absolutely anything I needed. I didn't need surgery, but if it had been surgery, it would have covered that. It covered follow-up doctor's appointments when I needed a new cast, when I needed advice and went in for just asking questions, when I needed prescriptions related to it, or physical therapy. I got to say how much physical therapy I felt I needed. So the doctor told me what the goals were for physical therapy, but then once I started, it wasn't up to them to tell me that I'd met or missed the goals. I get to say, no, I'm not satisfied with this. Can I come back? Well, of course, just schedule it. It was so simple.
Wow.
It was great, very, very different than the American experience.
And so it was paid for through taxes? Or?
Sure, through taxes. They just see this as a human right, that people should have access to health care. And, it's a first world economy, just like ours.
Yeah.
They're a democracy, just like we are. It's not a socialist country.
Do you think we in the United States should do that or something similar along those
I
lines?
think we should do something just like that.
Okay.
I see health care as a human right. It should not depend on your income level.
Yeah.
We have great insurance because we have a great income for our family. And because we work for a certain kind of institution that doesn't exclude pre-existing conditions. The lower your pay, the worse your health care possibly doesn't exist for you, and definitely they exclude those pre-existing conditions.
So do you also think that if you're at a higher risk that people get denied and that affects the price of it and stuff like that? And do you think that they base the medical bills off of your healthcare and insurance rates at all?
Oh, I definitely think. They're in the business of making money.
Yeah.
Which is fair in another kind of business, but I don't think it's appropriate that our country should allow profit to be linked to whether or not a person gets appropriate health care. We are a first world country. We have money to take care of our people. People should be allowed access to things that will keep them healthy. And that's just not the case here. It's all about income.
Yeah. And is there anything else you wanted to add on the subject of insurance? Or do you think?
I think that covers it.
All right. Covers insurance. All right.